especially male clients, explain how pelvic floor therapy can help with sexual function.
For one, it's an individualized based approach, right? Not even everybody with ED, there might be something else going on. So getting a full scan of the body and what's going on there, because there might be a couple different things. And when you have a hands-on approach, you're better able to get to that root cause and figure it out. Is it stress and they're holding tension? And they need to learn to relax or work on their breathing patterns, getting that hands-on. Is it that they need that along with if they have a lot of tension and muscle, engaging and not letting go, and that's causing pain? Well, then where is that? And then you need like more manual release work done to those areas on top of working on the stress management, working on like breathing so that you can manage those triggers and try to keep those at bay, because down the road, you need to have the tools in your toolbox to manage this if it, comes up again, because easily can with people that have pelvic pain, things like that. If you're not managing your stress or your daily habits and stuff, then you are not good at like a home program. If you really need to be diligent about breath work or like pelvic floor relaxation techniques, it could, have like a relapse and, have pain down the line. It's about like teaching people how to manage their symptoms and have the tools in their toolbox so they don't always have to come, to a pelvic floor therapist and, to help with that. I'm one that I don't always use the names of all the muscles and stuff. Like if you generally know like what the pelvic floor is, like there's a squeeze component and a lift component. Like basically that's what people like to know, what muscles sort of do the squeezing, which ones help with the lifting, but then what you need to do for like relaxing the pelvic floor and what that should feel like. I think that is most important when you're talking to people about pelvic floor work, because it's kind of hard knowing what you're supposed to be doing or feeling, because a lot of people don't have that awareness in general, that part of their body that, oh, I can squeeze or lift this or relax it, unless you take courses and are really in tune to what they're talking about in those courses. It could be really hard to connect. I have a client right now, a woman, she has a hard time with connecting with her breath, and she can't feel the pelvic floor relaxing or coming and going. She's in the medical field, but she has a hard time even with like knowing muscles and other things like that. She has a hard time connecting with that area of her body. I haven't had a lot of men per se right now, but my mentor, she says that men are very good and aware of what you need to do that squeeze and lift, and they're very good at disassociating that better than women, because we tend to just squeeze and everything, but maybe men with the anatomy, it's easier to do the squeezing and the lifting and separating which muscles you're doing that because of how the male anatomy is with a penis versus a vulva.
Actually, I usually find myself getting a little bit awkward when I'm trying to explain like how and where you feel the squeeze to a male client. I don't have a penis, so I don't know exactly. Yeah, what you said about having that disconnection and awareness, it didn't click for me that my brain for move from my brain, because I always associated, and I was already doing sex counseling with people. I was probably doing like internship hours, and I always associated with my clients have like insertions, exercises, and stuff like that from the break for therapist. I always thought about, well, when you relax, then you put it in. But it wasn't until I started reading about how the breathwork works with the breathing and how it moves, and started making that, oh, wait a minute, this is bigger when I'm breathing in. But in my head, it was like you exhale and then you put it in. How do you coach people through this?
Some of the cues for them that are helpful for that initial, we're going to squeeze and lift, is nuts to guts, pulling it in and contracting those. That's really good, because if it's cold and stuff outside, or like getting into a pool that might not be heated, that, oh, we got to nuts to guts, like pull it in. That's a really good cue to get them to associate with that. Another one is I usually talk about like sitting on the toilet and relaxing, and like the testicles, you're gonna like let them hang low. So you're gonna, relax. That way they kind of understand because they've done this before. They might not like think about it, like, subconsciously they've done these movements before, but that's usually like the type of cues I give if I want to breathe and relax. Like another good one for men for the squeeze and lift part is we're going to squeeze like we're not going to have urine or gas. Oh, we're going to hold it. That's a really easy one for most people to learn and do for that squeezing part. But the relaxation part is a lot harder because it's more like when you're having a bowel movement and need to relax and open the pelvic floor, but without bearing down. And a lot of people have a hard time disassociating that because people tend to want to they think bearing down when they're having a bowel movement and breath holding is what they need to do, when that's putting a lot of pressure on the pelvic floor and doing the opposite of what you want to do, where you want to breathe and try to picture holding the anus open and keeping it open when you're relaxing and breathing out to have a bowel movement. Those are some ways to try to get them to visualize that relaxation. And I tend to tell people I use the elevator technique a lot in picturing your pelvic floor and doing exercises like with the elevators. Your normal sitting, laying down, or whatever, you're resting where you're not voluntarily engaging the pelvic floor. That's your ground level. And when you go to squeeze and lift, okay, the elevator's going up. We're going to floor 1, squeeze a little harder. We're going to floor 2, squeeze a little bit more. We're up to floor 3. And then when we relax, we come back down to the ground floor. When we do more of a relaxation, then we're thinking instead of being on the ground floor, we're going down to the basement or the garage where the car's parked. We need to, take that lengthening breath. Now we're visualizing that we're going down to the next floor down and taking that breath and trying to really open up and expanding open the pelvic floor. I use the elevator a lot, and a lot of people can visualize that easier for them, and riding an elevator when they're trying to do those.
I've never heard that one before. And I feel like it's very gender neutral. You can teach it to any group of people and you can still click with it no matter where you are. In that practicing of how much to squeeze, is it difficult for people to hold it as well?
Yeah, it just depends if they have true weakness because the muscles are weak. It can be hard. So you don't want to be like squeezing the life out of things either, because you don't want to go from one extreme where you're having weakness to causing a problem. Some people that have pelvic floor tightness to begin with, when you have a tight muscle, it's a weak muscle. So it does have a hard time engaging and holding. You want a cue where they're not doing a max, like as hard as you can squeezing. You want to squeeze and hold it, but not like you're putting 100% effort into it. You want to start, I would say, 3 to 5 seconds at the most, where you're just holding it, and then work up to longer holds or stronger holds. That way you don't put yourself where you're aggravating something, especially if you're someone that has tension to begin with or pelvic pain. You want to make sure that you've worked and done your relaxation and that you're not triggering more overactivity. So you really got to work on down training the whole nervous system first and get to that where your true baseline is, where you're not having pain, and then work on building up that strength slowly in a parameter where you're not over engaging things and maybe causing the pelvic pain because you have tension. You want to gently be able to just control that squeezing and lifting and holding, but also be able to relax fully so that you're not, going back and forth into that pain or that tension.
That is the point where I can be helpful still, like in the breathing patterns and understanding like how does the day-to-day affect your nervous system and things like that. I just always feel like having somebody do, even if it's just preventative care, like just get a full checkup that includes your pelvic floor. Because I feel like when you go to a full checkup, they never actually touch you most of the time. Can you explain a little bit more how a muscle can be both tight and weak?
The easiest exposure that we can give and show is if you use the bicep analogy. When your arm, any muscle, this could be leg, I'm just going to do the arm because you can see it. When you have good full range of motion, the muscle moves all the way to the flexion, all the way to extension, right? So if you're weak, you just have a hard time making that contraction to move the muscle, right? Let's say you could still maybe move or not move through that range of motion depending on how much strength you have, right, in the muscle. So if it's weak, then it can't pick it up because it doesn't have the strength to make it through that full range of motion. If you have tightness or tension in a muscle, that means that the muscle is not able to go through its full range of motion. For this analogy, I'm using my arm and my bicep. So let's say that I can only go this far, right? I've lost that much range, right, in that muscle because my muscle here is engaged and holding my arm at this location, right? I'm only able to squeeze and power that much because I've lost like this much. So I don't have the power and the strength that I have because my lever now in the muscle is shortened and in that shortened range. That's how a muscle can be tight and weak, is because it has lost most of its power and its capability because it's in a shortened position. It doesn't have its full length of muscle to be able to pull from those muscle fibers to engage and do that motion. So the pelvic floor, those are a lot smaller muscles than the arm, but it's the same concept. If there's a muscle or a group of muscles that are holding on to give stability because you're weak in another part, let's say your core is weak and you have a lot of back pain because the back muscles are actually holding on and tight to give the stability that the core is not giving. You've got those muscles, when you like engage the core and start getting the core to be stronger and to like show up to the party to like do the work. The back muscles, if you get them to like relax, they're still going to be weak and you may still have some pain back there because you need to now strengthen them because they were in a shortened position and we need to lengthen them back out to where they are and then work on the strength and stability from there because they were really just in a survival. They're just holding on for dear life to give you some stability because the other muscle groups were not providing that stability that it needed. It can come from different areas. It could be the hip muscle is not working right, causing that. So it can come from different parts, but that's basically how that works.
All of these areas can affect sexual function.
Yes. Your pelvic floor is not just the muscles, at the bottom of that hammock. You're talking about your back stabilizer muscles. You're talking about your deep core abdominal muscles and your other hip stabilizers. Those are all come into play. And if somebody's not showing up correctly, then, the other muscles can try to do stuff that they're not meant to do. That's how you get pelvic floor tension and other things that can affect the pelvic floor. And habits, how you do things, if you're active or not active, they all play a part in that.
Is nuts to guts the equivalent of a Kegel?
Yes, that would be the men's version of telling them to Kegel is the nuts to guts.
The series is her cue for women is like you're picking up a blueberry.
Yes, that's why I like the elevator better because it is more gender neutral. And if somebody's like can't really picture picking up the blueberry or an umbrella, I think you just need to have other cues because some people just might have a hard time visualizing certain ways and getting that action by telling them those cues. So I think for men, the nuts to guts or the elevator are easy because they understand. I think it's more complicated for women to understand that.
What are you looking for in terms of males? What would be preventative care? Are there specific ages where you will suggest a general checkup that includes that area? And what are the signs that something's definitely going on?
I had pulled up a little facts knowing that we were going to come and talk about men. A lot of men, it says that they wait 4.2 years before they seek help. I think that women and pelvic health, we don't talk about it and it's like taboo. But as much as women aren't seeking care or talking about it, and it needs to be more in the mainstream, it's severely less for men because they don't want to talk about it or think that is something that applies to them. Because I don't think physicians, other than a prostate exam, I don't think they're really talking to them about, are you constipated? Are you having trouble peeing, pooping, or having sex either? I think any time is a good time to see a pelvic floor therapist to get a baseline, right? Even as women, because when we go see the gynecologist, they're not doing a baseline anything, right? But yet we think we're okay, but there are more things that we can do. For men, I would say that if they feel like there's any changes, it's a good time to go, get checked out. With men, therapy success rates are up to 80% within 4 to 7 sessions. They have more muscle fibers because they don't have like the vagina that goes through and separates, we have that little gap there for the vaginal canal to come through. So that's why we have a lot more incontinence issues and things like that, because they have, their pelvic floor and their muscles, are closer together. They don't have that gap that we have with women. It's easier to, recruit those muscles and treat, those issues. And all of the issues like erectile dysfunction, problems with ejaculation, even post-prostatectomy or pelvic pain. Pelvic floor therapy can help men just as well as women. They just need to know that help is out there and to look for it. Like, look for a pelvic floor therapist in their area that works with men, or ask their urologist, who they would refer to.
I have heard you say before that incontinence is not, even though we have been kind of conditioned to believe that that comes with age. Does the same apply to sexual function, or how is it different? How do we know it's part of aging, or there's an actual issue?
Sexual function, it shouldn't be a big, huge decline as we age. It might because of hormones. Hormones change, and that's a driver for sex, right? For women, for lubrication, for the tissue health for women. For men, the hormones are going to play some role in if they're having problems with blood flow too. So anything that affects the blood flow to the area that would mess with the erectile dysfunction, or if they're having enlarged prostate, some medical situations like with the prostate or blood flow is going to affect their sexual performance. But it shouldn't be a normal part of aging that, like, I'm not going to be able to have an erection or be able to have intercourse with my partner at any age. If they are, then therapy can help. If they're on certain medications for, let's say, a heart issue or something, that can affect your sexual function, but they might be able to change your medicine, or you might be able to work with a therapist to figure out what can help you with getting the blood flow there. There are other ways, so that way you can enjoy having sexual relations with your partner. It shouldn't just go away because you're whatever, however old you are.
For most people, once you get issues with erections, that's a signal that you should get a full check of your hormones, but also your heart is healthy. But I feel like for most people, they go, oh, I have this issue. Here's a pill. Bye. Same thing for women. You have pain. Here's a numbing cream. Or when they have PCOS, here's birth control. Is there such thing as training your pelvic floor to prevent these issues? Programs or an exercise that people can just add to their daily life, or just to prevent issues in the long term?
Well, I like to say that any type of exercise is a pelvic floor exercise, right? Because our pelvic floor moves and breathes. When we're breathing and when we're moving, the pelvic floor is working. If you're going to the gym and you like to lift weights or whatever, your squats, your lunges, those are all pelvic floor exercises. It's just being more cognizant of your breathing patterns. Are you breathing in and out at the right time when you're lifting and how heavy you're lifting? That's important. If you do any type of like meditation or yoga, incorporating some of those more mindfulness activities to help with stress response and down regulating the nervous system, that would help, because a lot of us were just really on high. Our nervous system is revving way too high anymore, that we never fully relax. So trying to add some sort of meditative self-care aspect would be a huge step to, helping the pelvic floor, without even seeing a pelvic floor therapist. If you could work on that, might be a big game changer, right there. And then, working on your mobility. As we age, we tend to stop moving around and being so mobile, how we're lifting, we turn, we bend, because when we start having hormonal changes, like the lack of estrogen or testosterone, our bodies start to stiffen up. So when we start getting more stiff in our joints, we're not moving because we don't want to fall, or there might be pain. Our body needs that lubrication and that movement to keep us healthy going forward in age. And instead we stop moving. So that's really what we need to do, is incorporating gentle movement like Tai Chi or yoga, even if it's chair yoga, whatever, things like that to keep our body as mobile will help as we age.
In yoga, usually the way we do it is we expand, we breathe in, we contract, we breathe out. How do you coordinate your breathing with lifting weights?
Generally, when you're lifting, whenever that lifting and you need that power, that's when you want to be breathing out with that pursed lip breathing, and you want to engage the pelvic floor. So if you're doing a squat, you want to breathe in when you're doing the actual squat, and when you're standing back up out of that squat, that's when you want to do that forceful exhale. That helps the pelvic floor to engage and support when you're doing the actual power move. So for anything, if you're doing shoulder press overhead, same thing. Whenever you're actually doing the actual lifting or the pushing or the pulling move, that's when you want to do that exhale to help. Now, you don't have to engage the pelvic floor like doing a strong squeeze and lift. I mean, maybe if you're lifting way, way heavy, like power lifting, but for most people, they're just regular exercisers and lifting heavy, but not crazy. That's how you should be, lifting to support, your pelvic floor.
I feel like that part should be more thought and talk about in the exercising community, because that prevents back pain and injury. Even just doing yoga, they hold their breath.
Mm-hmm. Yes, breath holding. It's really hard. If I'm lifting heavier, if it's getting hard, I notice that I hold my breath. We tend to do that because it gives us stability, but it also puts a lot of pressure. The pressure is either going to go down into the pelvic floor, or it's going to come out that, abdomen. You think about people that get hernias, things like that from lifting, because we're holding our breath. So we really need to work on making sure that we're breathing correctly and not holding our breath the whole time. But you want to inhale, and then when you're doing that movement, and that will give you more protection.
Can you talk a little bit about prostate health? What are the basics?
Well, for men, the prostate is there that helps with the sperm and during the ejaculation part when they're having sex. It tends to have problems when there's nerve injuries down in that area, like the nerves for the pelvic floor. There's one branches out into 3 different areas that affects the pelvic floor, the bowels and the bladder. What we need to think about for prostate health is probably So making sure that we're drinking enough fluids and being hydrated properly. And then also if we're sitting a lot and we're putting pressure on the nerves during the day, like making sure that we're getting up, being cognizant of how we're sitting and moving during the day. And I think that right there will go a long ways to help with the not have nerve entrapment or pain down in that area, but also working on down regulating our nervous system. If we're having a lot of tension and stuff down in that area, everything's like being, held up and engaged. We need to like really work as a whole on regulating our nervous system. I'm not a urologist, so I don't know like 100% the ins and outs of like the prostate and how that works. But I do know that even after, if you have to have prostate surgery, that a lot of men have problems with like incontinence after prostate surgery. It is not prescribed a lot, pelvic floor therapy after prostate surgery, but you don't have to live with like incontinence or having problems with that, for the rest of your life afterwards. That there can be a 90 to 100% like not having incontinence problems after a prostate surgery. More men should have that option to go after surgery to a therapist, and people, they should be getting prehab. So before surgery, they should be seen, and they're not, they should be seen by a pelvic floor therapist to get a good baseline of what their function is and know how to breathe and work on those muscles before surgery. And then afterwards, with the education and whatever manual hands-on techniques that they need, along with some lifestyle changes, they should not need to be wearing pads or taking medicines for that down the road.
I didn't know that was the thing, prehab.
Yeah, it can be. It's not prescribed. People don't know about it, but like you can just with like any other, some people have before hip surgery, they go to physical therapy to, work on strengthen those muscles or, work on balance, things like that. You can do that with before any type of surgery, C-section, hysterectomy, a prostatectomy. If you're having any colon type surgeries or even gallbladder or appendix, things like that, you should have the option to see a therapist beforehand so they can see how your mobility is in the visceral cavity of the abdomen. If you have tension or where it's not moving quite well, but also work on strengthening, giving you the right like tools that you need to for moving like in and out of bed properly, and how to breathe or take care of yourself. Like those are all things that we can go over and you can be working on in those like 4 to 8 week time after surgery before a therapist can put their like hands on you, that you could like be doing some of these things at home and work on it to have even a better recovery afterwards.
So if somebody comes complaining about erectile dysfunction, premature ejaculation, or delayed ejaculation, what are the first steps that you will take? How will treatment look like? Is it something that you will recover afterwards, or you just learn to manage it?
When you come in for any of those type things, what we're going to do is we're going to do a full, like, comprehensive exam. We're going to look at your movement patterns. We're going to look at, have you had surgery before? Do you have scar tissue? How's like the external movement of your body? Then we will look at like the pelvic floor. How is it moving? How is it working exteriorly? If we need to do more internal work to determine strength of muscles of the pelvic floor, or to figure out if you're having tension and pain, and if you need some release work done there are certain muscles that we cannot with our hands reach on the outside of the body that could be causing pain, tightness, limited mobility. You can only reach those internally. So an internal assessment, if the client is willing to do that, we do that to get an idea of what muscles are affected. Them, if it is they're having a tight hip rotator muscle, besides a therapist working on it internally, we can give you the tools that you need to. Maybe you need a pelvic wand. We can teach you how to use a pelvic wand to reach those areas and to do your self-release work. So that way down the line, after you're graduated from therapy, and you might have a relapse or something, you're able to have that tool in the toolbox and, work that on your own. You may not have to come back to, a pelvic floor therapist if you have the right tools and, have had a good, being consistent with your home exercise program, after you graduate. It's not to say you have to do it like every day, like a militant thing, but if you can be cognizant enough of it, and maybe you only need to do it one time a week, and that's all you need to do to keep you, and you're doing a good job with your nervous system regulation and stuff like that, you may only need to do your home program 1-2 times a week at the most. But like if you're a person that is in a very type A personality or high stress job, maybe you need to do it more consistently to keep you at that baseline that we got you at the end of your therapy. Because I don't have a crystal ball, I can't ever tell people how things are. I don't give people absolutes because you never know and everybody's different. So it just really depends on the person and what is happening for them, because not everybody's the same.
And I have seen often people struggle with keeping up with their exercise at home because it comes so loaded with a lot of other emotions sometimes. I feel like that is one of the biggest obstacles for them to do their homework because it feels overwhelming. So they're doing well in therapy, but they don't take it home and it takes them a little bit longer to recover.
Yeah, I think it's the buy-in from the client. I think when you get to the point that it's like you can't take it anymore, those are the type people that have the best recovery or do the best because they've bought all in. The person has to buy into it. It can't be just like, maybe I'll try it, or maybe this might or may not help. But I think you have to get to that point where it's like, I don't want to deal with it anymore. Like you're at the rock bottom. Those are the people that have the best because they are all in. The people that are easiest to work with because they'll do absolutely whatever because they don't want to have to deal with it again. I tell anybody, yeah, I'm telling you all, this is the things that will help you get better, but I'm not the one that has to do it. You do. So you need to make it manageable for you. If you can only do one exercise a day, pick the one that you're going to do and be most consistent. If it's the relaxation exercises and the breathing, then do that one. Or, habit stack it with something else. Make it where you're most consistent doing it, because it's the consistency that's going to move the needle forward in your healing. If not, you may get 80% better. You're okay with that. That's great too. I try to have an approach like that with my clients, is that I want you doing these, but I don't want them to be an obstacle. I need you to figure out what works for you. And if it's 3 days a week, then I need you to pencil those 3 days in. And, I don't want you to spend an hour doing homework. So if it's like 5 or 10 minutes, if you're really doing it and you're consistent, 5 and 10 minutes, and that moves the needle forward, that's more important than zero. Something is always better than nothing in my book. Getting the client to buy into it, that's the hardest part.
If people were to take one thing from you today, what would you want it to be?
Men's have pelvic floor, and they need to know that there's help out there, and that they need to advocate for themselves. If they go to their primary physician or urologist, ask for that referral to a pelvic floor therapist. A lot of states, you don't need a referral to go see a physical or occupational therapist. Some insurances require a referral from a doctor, but a lot of states, if you want to go to be seen, you can be seen. I live in Florida. We're open access. I don't need a doctor's referral for them to come see me if they want to be seen for a pelvic floor issue. Just as much as women need to know about pelvic floor health, men need to as well. Yeah, it's kind of weird. It's taboo, because we're talking about like intimate areas. But it affects so much more of our life. If you want to be okay with like how you're living, that's one thing. But like if you want to have better relationships with your partners, if you want to feel better and be able to go in the theme park and walk around all day with your kids or a loved one or your grandkids, then it's worth it, because you're going to miss out on other aspects of your life because you're dealing with pain or discomfort or whatever. Help's out there. Look for it.
Are the areas of Florida you're serving now?
I serve the Pinellas, Hillsborough, Pasco area, but I can do virtual anywhere in the state of Florida. I can see you virtually.
How does virtual work if you cannot do hands-on?
We walk you through and help with muscle mapping and things like that. So we have to have good conversation and communication back and forth. I don't look at anything on the screen or whatever, but I am, coaching you through, having you put your hands certain places, asking you if you breathe, can you feel this moving? Can you not? Thing if you need to do some interrectal work or vaginal work, I give you cues and ask what you're feeling, things like that, and you can report it back to me. There's been a lot of therapists that are doing telehealth or teletherapy, and people are getting good outcomes without hands-on. It's always going to be the best because you have a trained, qualified professional there with you. But again, access is key. Something is better than nothing. And if, you can get seen by someone and they can help, without putting their physical hands on you and move that needle forward, that's great too.
Thank you. Thank you for taking the time to share today. I know it was your first day after vacation. I appreciate you making the time for that.
Thank you. I'm here to help people. And so that's the most important part.